Okay, my name is Alejandra Vega, and I am going to be presenting on the false positives of MRI. The title of my article was The Accuracy of MRI in the Detection of Lumbar Disc Containment. For those of you that don't know, MRI stands for Magnetic Resonance Imaging. I'm sure you've heard the word thrown around here and there. MRI is a technique used to form pictures of anatomical and physiological processes in the body. So in this case, disc herniations, but in other cases it could be meniscal tears, labrum tears, ACL tears, anything like that. So going into this, it's important to know that more than 80% of Americans will experience some form of back pain throughout their lives. So just remember that. It's a lot of people. It's really common. So just keep that in mind. In this study, a group of doctors got 50 patients consisting of 35 males and 15 females, ranging from ages 28 to 68. All of these patients were undergoing lumbar microdiscectomy, and for those of you that don't know, I drew a picture. So basically, it's when the lumbar fluid in the disc vertebrae is pushing on the nerve. So what this surgery does, it decompresses the nerve, basically. So this is a disc, these are the nerve roots, and this is your vertebrae, right? This is a cross-section of you. When someone has a herniated disc, the fluid leaks out and hits the nerve, making the nerve inflamed, right? So that's when you get pain. You'll get pain, low back pain. If it's a sciatic nerve, it'll be compressing the sciatic nerve. That's why people get pain all the way. So these patients were prospectively evaluated, right? So an MRI was taken, and after the surgery, they found 3 herniations that were the most common between the patients. So between L3, L4, L4, L5, and then L5S1. So the MRI results from these patients detected that the MRI was 72% sensitive, 68% specific, and 70% accurate. Only 70%. So the MRI was inaccurate in assessing lumbar disc herniations in 30% of cases in this study. It's a lot. So I'm sure everyone has gone through or knows someone who's gone to the doctor and said, hey, this hurts or something's going on, and the doctor will order an MRI. So, hey, go get an MRI, whatever, here's some pills or something, come back and we'll see what we do from here. So they'll go to the doctor, get the MRI, which MRIs cost about $2,600, so $2,600 in the US. That's the average of MRIs. They'll come back and then the doctor will order, whether it be surgery or physical therapy or so on. So in 30% of cases, the MRI wasn't even needed. A patient went and spent all that money for no reason, just for a false positive. Maybe right, maybe wrong, we don't know. 30% of cases, there's a false positive. So in this study, they said the accuracy of MRI, I quote, in detecting containment has been insufficient. Another quote from the study. Other methods to assess containment should be employed to assess containment when such alternative interventions are being considered. So there's many other ways that you can know, that something's torn or that something's herniated, not just with an MRI. It's an expensive form of imaging, and even then, it's not really necessary, So if somebody knows they have a torn rotator cuff, it's torn. There's bruising. There's other symptoms. Symptoms can tell you if something is torn or herniated or things like that. It is not necessary to go and spend $2,600 on a picture for it. And in 30% of the cases, the doctors went in to do surgery, and then they see, they didn't even need it. That's time and money wasted on the MRI. That's time and money wasted on the surgery. And there are much more effective ways in finding out what's wrong. Okay.